holistic health in general, different vitamins, different supplements, and other illnesses, and what you can do about those. Today I want to talk about an issue, though, that's very close to me. It deals with the man's prostate. It's called BPH. BPH is known as benign prostate hypertrophy. That's one of the terms given to it. There are a lot of illnesses involved with the prostate. Some of them are known as prostate cancer, torsion, prostatitis, testicular cancer, and erectile dysfunction. Today we want to talk about BPH, though. It's an ailment that most men will deal with in their lifetime. It doesn't start out until after they've turned around 50 or so. You see, in the early years, when a male child is born, the prostate is about the size of an acorn, which isn't very big. After about 40 or 50 years old, it starts growing a little bit. Sometimes it gets as large as a lemon. Sometimes it gets a little larger. Just depends. What causes this is that the male body, stops making testosterone as much as it used to when it was young. And the testosterone allows other elements to take over. Now, diet is another part of it. Those who eat a lot of fat, those who eat a lot of meat, those who don't exercise, these guys are going to be prone to develop enlarged prostates. My father developed BPH when he was younger. He didn't take care of it. It developed into prostate cancer. He ignored the signs, and it ended up taking his life. I was diagnosed with BPH several years ago. However, there are things that you can do non-medically that help. Now, the prostate's an essential organ in the male body. It exists for the purposes of procreation. It secretes seminal fluid when the muscles in the prostate contract during ejaculation. In fact, the bulk of semen produced is produced by the prostate. Now, as I told you, it occurs when men get older and their hormones change. The production of testosterone decreases, and other hormones such as prolactin and estrogen increase. And as they increase, it also increases dihydrotestosterone. And what this does is causes the cells in the prostate to develop quicker, and that leads to the enlargement of the prostate. Now, there are a couple of medical things that can be done. The pill that's normally associated that doctors prescribe is called finasteride. There's another one that's called tamsulosin. And while they do shrink the prostate in about 40% of the cases, they also have side effects associated with them. The main side effect of finasteride is that it can lead to prostate cancer itself. The other effect, and I've not had a doctor tell me this when they gave me the medication, it can lead to impotence. If you don't take care of an enlarged prostate and the symptoms continue, symptoms being difficulty in urination, getting up several times a night to go to the restroom, always feeling like you've got to go. If you don't take care of those symptoms, it eventually causes your bladder to weaken. And with a weakened bladder comes the possibility of bacterial infection. So you could get a urinary tract infection. There are more natural ways of dealing with BPH. One of the first things a guy should do is to start increasing his zinc intake from about 30 years of age and on. This could be just as simple as snacking on some pumpkin seeds, eating some oysters, or eating more lamb. Another thing you can do is keep your cholesterol down. Cut down on or quit altogether consumption of alcohol, coffee, or tea. And lastly, another thing that you should be doing is getting involved in a physical fitness program of some type. Most all men will also benefit from a comprehensive nutritional daily supplement, full spectrum vitamins and minerals, which would include a high dose of essential fatty acids, another thing important for prostate health. BPH can be reversed. The best way to deal with it, however, is to prevent it from the start. So guys, when you start getting the signals and the signs that you're having a problem going to the restroom, don't try to tough it out and be a man. Go to the doctor, get your prostate checked. If your prostate has a problem, there are things that you can do about it. The following supplements have been used for BPH in the past: zinc, vitamin B6, the essential fatty acids, glycine, glutamine, and alanine, pumpkin seeds, olive leaf, thistle, saw palmetto, and panax ginseng. Guys, there's no reason to suffer, and there's no reason to have to take what the medical community wants to serve on us as the remedy for BPH, which is medication or surgery. There are other alternatives. Thank you, and tune in again next week when we talk about